Hello and welcome to our webinar on Patient and Public Involvement, or PPI, in the Wessex Applied Research Collaboration. My name is Caroline and I'm the Strategic Lead for Public and Patient Involvement in Wessex ARC. In this webinar, we're going to let our public members talk to you about the work that they've been involved in and how they found it. It's an opportunity really to hear from their perspectives what it's like to be involved in ARC and the kind of things that we get up to. But we hope it's also a starting point for our future conversations with you, either as a public member or as a researcher or staff member within one of our organisations. We are just getting ready to write our strategy for the next 4 years, and we would like to hear from you about what you would like to see going forward, how you would like to be involved and benefit from our work. So we really hope you enjoy watching the webinar and learning a little bit about the things that we've been up to. As I've previously said, I'm Caroline, and I'm just going to give you a little bit of information about me. I am particularly interested and passionate about the equality and diversity agenda. So a lot of my focus is on how we ensure that the voices influencing our research are from all sectors of society and from all of the communities living within Wessex, rather than just a select few. I love my role. I love working with public members. The people you're about to hear from are not just my colleagues, but I consider them my friends. My background before this was that I used to be a researcher. I worked in a lab. I didn't do patient and public involvement at that point in my career, and I think that my research and my fulfillment for that research would have been greatly enhanced if I had the kind of relationships with public members that I have today. So enough about me. I'm going to hand over to Catherine, who's going to introduce herself, and then you'll get to hear from our public members.
Hello, my name is Catherine. I am the Patient and Public Involvement Officer for the Applied Research Collaboration Wessex. Thank you to Caroline for that great introduction. I'd also like to say thank you to our contributors, who you'll be hearing from throughout the rest of this video. As the Patient and Public Involvement Officer, I'm involved with both the researchers and members of the public, bringing them together, better involvement in research. And we define this as an active partnership rather than people participating in the research themselves. My background is in community work. I've worked in pharmacy and in smoking cessation services, and I feel quite strongly about getting younger people involved in research and getting their voices heard. I'd like now to hand over to Sally and to Cynthia, who are both members of the Clerk, which preceded the ARC, and hear a bit more about their stories and how they got involved in public involvement. Cynthia, how did you get into PPI or public involvement?
Hi, Catherine. I got involved with public and patient involvement quite some years ago. My husband was diagnosed with Alzheimer's quite early on in his journey, and we were at the Moor Green Memory Clinic, and one of the nurse researchers there asked if my husband would like to be involved in a pharmaceutical trial. And my husband, because he was of an altruistic nature, he said of course he would like to do anything to help. And we were given a box about this big of paperwork all about the research and the drugs, and we were given patient information leaflets and consent forms, and we were asked to go home and read it and then come back, sign the forms, and he would start on the trial. And we took the box home and we read it, and we came back a few days later to the memory clinic and said we couldn't sign because we didn't understand any of it. It was written in medical jargon, scientific jargon, sentences that were 63 words long. I mean, you practically suffocated holding your breath while you read them. So I said no, we couldn't, because we didn't understand any of it. The nurse, the research nurse, was brilliant actually. She was fantastic, and she explained everything to us. And after it was explained, we said yes, we would go ahead. He is the patient and he is his carer. But I did actually write on the consent form that I had understood about the trial from the research nurse, not from the documentation. And they were a bit worried about this, but anyway, it went ahead. But the people who were running the trial there at Moor Green asked me if I would be interested in joining a committee that looked at lay summaries, that is a summary of the scientific research, but written in lay language for ordinary people to understand. If I would like to look at those summaries, and if I would like to look at patient information leaflets and consent forms to see if they were written in accessible language. And of course I was delighted. I was really pleased to be able not just to look after my husband, but actually to do something to help towards the research. And that really began my journey.
Well, I was disappointed with the communication and processes when a relative was in hospital, and I really wanted to change things for the better. And I was approached by a friend via Facebook who had connections with the clerk, and she asked whether I would like to become involved because some of the research areas were covering some of the things that I was talking about. So I thought, oh, this sounds interesting. So I agreed to have a meeting with the PPI lead. She actually came to my house for a coffee, and we had a really nice sort of informal chat about what was involved, what I would be doing, how much time it would take. And I was happy at that stage. So I then went on to meet with the research leads for the theme that I was interested in. We met up, and I think we had lunch actually, had a chat about what sort of research they were doing and how I felt about it, and whether I'd like to be involved and what might be required of me. And I agreed to come on board, and long story short, from there I became involved as a PPI champion and a member of Wizard.
I'd like to say thank you to Sally and Cynthia for sharing with us their PPI stories and how they got involved. We'd like to take this time now to talk about the strategic group called Wizard that sits within the ARC and that was formed out of the clerk. This group is a mix of PPI officers, public representatives and staff links that are there to provide strategic direction and advice to ARC Wessex about how to involve patients and the public in our organisations and programmes. Each theme has at least one champion, a public contributor linked to work in that theme, a staff link who can share and disseminate information, and everyone is supported by both myself as the PPI officer and Caroline as the PPI lead. Everyone you're going to hear from in this video is a member of Wizard and have taken part in activities this year. I would now like to introduce you to Jean and to Antony, who are both newer members of the Applied Research Collaboration and have joined us since March when they first attended the stakeholder event, looking at where we want to go over the next 3 years of the ARC. Here are their stories and the things that they've been involved in during the last few months. So, Jean, how did you get involved in the ARC PPI?
Well, it was through a visit I had at my doctor's surgery for my annual asthma checkup, and the nurse said to me, "Seeing you've just retired, you're an ex-social worker, maybe this might be up your street." I am involved with the university, interviewing students and being a simulated patient, but I thought, you know, I'll give it a go. And then I actually went on the website, and then I met Catherine in February 2020.
About 3 years ago, I went to Dorset County Hospital where they were looking for patients' research ambassadors and became one. And in March this year, there was a conference run by the ARC at Wessex, at Southampton, and the agenda looked so interesting that with the agreement of the hospital, I went to the conference and somehow found it so interesting as a subject and an area that I wanted to do more.
So Antony is involved with the workforce theme with Peter Griffiths, and I'm just wondering if you tell us a bit more about the work that you're doing in that theme.
One of the things that I was involved in when I first joined the NHS many years ago was in the human resources side, where workforce planning was only just beginning to start. And what we're doing now with the workforce planning team with Peter Griffiths is beginning to look at how the workforce is going to be active over the next years, particularly as a result of the COVID-19 problems. And we're looking at the whole of the working patterns of the community nursing system and how it could be better improved over a period of time. I'm also, luckily, involved with Ewan Sadler on another project, which is to integrate the health services with the social services units so that we can actually give united healthcare seamlessly for the community in the community.
I'd like to touch now briefly upon public involvement in COVID-19. We've been very lucky at University Hospital Southampton in the fact that our teams continue to work throughout the lockdown and have been supported by our organisations to do so. It has led to a changed way of working and how we've supported our public contributors, and a lot of this has meant moving to virtual meetings and training. This has sort of involved one-to-one tutoring of public contributors and also the PPI team, learning new ways of working via Zoom, Teams, Hangouts, and still traditional methods such as posting out information and phoning people. Our activities over this time have included our virtual coffee mornings, where we bring researchers and members of the public together to talk about interesting topics. These have included researchers from different themes in the ARC, such as long-term conditions and ageing and dementia. We've brought PPI contributors from the Wizard team together to look at the ARC PhD reviews and to mark them. And training has also gone virtual, and Caroline is now going to talk a little bit more about this. Here is Caroline going to talk about the training happening in ARC Wessex currently.
Hello, it's me again, Caroline. I'm just going to tell you a little bit about some of the training that we've been doing. So part of the work that Catherine and I deliver is that we provide training and guidance and opportunities for both public members, but also researchers and other members of health and social care with a role in PPI to upskill themselves in this area. This is so that they can work better and more effectively together. So one of the things that just finished was a skills-based training programme for researchers. It was 5 two-hour sessions and it was meant to be in person, but obviously we've had to take it online. So myself and Pam, who is a public member, co-delivered this together. And we really enjoyed working closely with a tight group of researchers to really help them upskill themselves in the PPI area of their work. And we are really looking forward to seeing what sort of impact this training has had on their research projects as we move forward into the future. So as well as the research training programme, we've also been developing lots of opportunities for public members to gain skills. So we're hoping to do some training around confidence building and training on presentation skills, among other short kind of courses. And we really hope that these opportunities will benefit our public member community, who we view as equally important to the kind of embedded research community themselves. So, as Catherine mentioned, during the COVID period, we've also conducted PPI reviews of PhD proposals. So this was a competitive funding bid for ARC to fund either part or whole of PhD studentships. So each member of Wizard were asked to lead on reviewing and scoring 3 proposals each, and then they came together as a group to discuss their thoughts. These were submitted to the ARC training panel and used to inform the final decision for which PhDs were funded through ARC Wessex. Jean is going to talk a little bit more about what happened and how she found her experience.
To Caroline, to actually take part with a group of 5 of us to go through the PhD reviews. And initially we'd have 3 reviews each. Then we do that and read all about it, make all our notes. It's very interesting. And then we arranged a time that suited everybody. And then we had a virtual meeting where we went through individually all the reviews that we had done, you know, individual. And then it was great because we had an opportunity for people to talk very objectively about what we had just presented. And it actually worked extremely well. And I hope that the ARC does that again in the future, because I thought it was really good. And we all worked very well together.
Lockdown in March, it was very difficult for the researchers to carry on with some of their work, and obviously COVID-19 took priority. And this applied to public and patient involvement members as well. But we have a fantastic team at Southampton Hospital, led by Caroline Barker and Catherine Baker. And they got us all involved in something called Zoom, which I'd never done before, but it was fantastic. And what was actually wonderful about it was that all the public and patient involvement contributors throughout the whole area of Wessex, we were able to join together and have well, we sort of had coffee mornings. It was an hour where we discussed various topics. And on one day, we've just had general conversations of things that interested us as individuals. And so we got to know each other on a very personal level that perhaps we wouldn't have done if we'd just been sitting at a meeting at the hospital where we would just be discussing what was in front of us. So that was something very new, and actually it was quite exciting, and I think we found it very enriching because we got to know each other on a personal level, which was wonderful. But we also had the opportunity of that Caroline and Catherine brought to us by introducing talks by researchers and people from the medical teams about the particular things that they were doing. So we shared ideas, we shared experiences, and we heard new voices. And I think that enriched us as individuals and as a group. And I actually hope that post-COVID, whenever that happens to be, that we will continue with this, perhaps on a smaller level, perhaps only maybe once a week or once a month. But I think it actually enriched all our lives, and I would like to see that continue in the future.
Thank you very much, Cynthia, and thank you for recording with me today. Anthony, was there a particular talk that you found particularly interesting, or one that you remember?
One of the people who comes to our coffee mornings, and Priscilla, who I think comes from Portugal, gave a presentation on the work that she was doing. She has a PhD in her particular subject, and she was looking at artificial intelligence and how it could be used to help her research and help give better treatment to the people that she was looking at in terms of their needs. It was fascinating, and because it was so detailed and the possibility of artificial intelligence was so widely possible, that it was extremely exciting. Now, that came out of the blue. None of us knew that it would be as exciting as a meeting as it was that day.
Thank you for watching our webinar. We hope you sort of found it interesting listening to our public contributors and about what's been happening for public involvement in ARC Wessex. We now would like to ask you if you'd be interested in joining us to plan public involvement over the next few years for ARC Wessex. We would be interested to hear from members of the public, charities, organisations and trusts that are all within the Wessex region. If you're interested in getting involved, our details will be at the end of the presentation. Otherwise, thank you again to our contributors, to Caroline and to everyone for watching this.